So the reason we conducted this meta-analysis is to come up with the worldwide burden of migraine. So we had to look into like all published studies in the literature examining the prevalence of migraine in all countries around the world. And so we looked into 100 years of studies. We had to start from the earliest study in 1933 and stop at August 2015, and almost spanning a period of 100 years. So we found we included 302 studies. The eligibility criteria were like community-based studies and population-based studies. We had to exclude clinical studies because, as you know, the clinical population is not representative of the general population at the community level because clinical studies focus on patients specifically coming to the clinic. So based on this, we came up with a final number of 302 studies. And yes, that was the final number of studies included. We had a combined participant size of over 6 million participants from all regions in the world, and we found a prevalence of 11.6% of migraine, and which means 1 in 10 people get the migraine worldwide. And then we looked into, we stratified the combined pool size into regions of like Africa, Europe, Asia, North America, and Central and Southern America. And we found that the regions of Africa, Asia, and North America and Europe had a comparable 9.7 to 11.5 percent prevalence compared to the Central and Southern American, which was relatively higher of about 16% prevalence. And we went on to look what the reason could be, and one potential explanation is the fact that the Central and Southern American region, the combined sample size from this region was quite lower as compared to the other regions. So it has to be cautiously interpreted within that sampling fraction. But the other results were there was a female preponderance 2 times, which is in agreement with other community-based studies. But more importantly, what we found were that urban studies, recent studies, and school-based or college-based studies had higher prevalences, like 20%, 15%. And these were found to have up to 1.5 times more migraine prevalence compared to the rural studies. So we are speculating the change behind these differences could be like the recent urbanization that is happening very fast globally, and also massive rural to urban migration and rapid lifestyle changes accompanying this movement of people, and also the socio-economic mobility happening in the global south of the world, where there is where a large segment of people are rapidly becoming affluent and thereby like moving to the urban lifestyle, and with all the sleep disruption, lack of physical activity, and all that. So we're yes, those are the things we are speculating. But yes, it would be important to study this more successively every 10 years to see the accruing results from the accumulating community-based studies and see the change throughout the time. One other interesting result we found was we checked whether there is a time series kind of pattern from like the early 1900 up to now, whether there was an increase in migraine prevalence, which we can interpret either intergenerationally or there is a genuine kind of pattern. And we found that all regions including the global combined pool size, showed an increase, progressively increasing migraine prevalence, except the Northern American. The reason for that could be the number of studies in the Northern American region are again lower. Especially, we couldn't find adequate size of school sample studies and younger age population in the Northern American sample. And yes, so the other point I'd like to emphasize is this rapidly changing prevalences in the global south, especially in the regions of Africa, Asia, Central South. The higher increasing prevalences could be are important, not only medically speaking, health-wise speaking, but also socio-economically, because these regions predominantly have a younger age group and are like the global labor force. And if this global labor force is being afflicted by such disabling disorder, a chronic disorder like migraine, it can have both health, but also not only health, but also a socio-economic impact. And so that being said, on top of that, we have to remember that these regions in the global south, their health system is designed primarily to respond to infectious tropical disease, but not this kind of chronic non-communicable disease. So these are areas which we try to stress in the paper. The take-home message will be migraine is an important burden, is an important condition, and especially this change, these differences, variations between the settings of the urban and the rural, the school, and the recent studies showing higher prevalence to the older studies. It indicates these speculations that I mentioned, such as the importance of physical activity like exercise, keeping a good sleep, regular sleep hours and hygiene, and also meal times, which are usually disrupted in a stressful urban environment. Yes, it would be important if clinicians can take this as a as a point, and also as a public health kind of for a public health policy change. Yes, so we want to repeat these studies every 5-10 years, and also one thing we want to study is as you mentioned, the different types of migraine frequencies, and also the other types of headache. We also already have data, and we also want to look into the age factor, into the school age group, because migraine as a primary headache disorder is a problem of naturally a younger age group, but so that could be the main reason why this school age group could be having a higher prevalence, not just because if it's a school setting. So we want to regress that age factor and see whether that school or the academic environment is really an environment for migraine triggers, those kind of things. And yes.